Hello and welcome to the Megacast. It's not a radio broadcast. It's not a television broadcast. It's not even a podcast or just some streaming thing on the internet. No, it's become huge. Can I say that without being accused of being partisan? It has become huge, my friends, right here in Oakland County. It is a Megacast, and we are all over Oakland County. Started in West Bloomfield, and then it couldn't help but grow because people wanted the information. The Megacast is on Civic Center TV, Channel 15, Channel 99 AT&T. You can tune in if you're an AT&T customer all around Oakland County, and then find the West Bloomfield links and go to Civic Center TV, and you'll see the Megacast. I personally like watching the Megacast on the web. Go to civiccentertv.com. You'll catch the Megacast in beautiful high definition. You'll like the whole thing. It'll look great. We also invite you to go to our wonderful radio stations all across Oakland County. We are live this morning on 89.3 Lakes FM in the West Bloomfield area, 88.1 WBFH in the Bloomfield Hills, Birmingham, Pontiac area, and covering the rest of Oakland County and a bunch of Macomb County. Booming from Avondale High School. Their big tower there with 2,500 watts, a lot for a high school radio station, is WAHS 89.5 FM. And we thank our friends, Logan at WAHS, Ron at the Biff, and all of our friends right here at Civic Center TV, Lakes FM, for making our broadcast possible. So, we are in the Lakes FM radio studio. My name is Dave Scott. Tyler Keefe will be checking in throughout the show. And we are here to bring you the latest in coronavirus information. Everything from how are we going to ramp back up to the quote-unquote new normal. We heard the president weigh in on that yesterday, the governor weigh in on that, the Republicans in the legislature weigh in on that. We've got all that today, and then we're also going to hear from some of our local communities and see how we can get back to some semblance of regular here in the state of Michigan. But we have to do that while maintaining health, and that's why we're going to talk to our own edition of Dr. Sanjay Gupta right here in the West Bloomfield area, and that is none other than Dr. Jamie Taweel will be joining us later on in the show. I've not had a chance to take a look at the market in the last half hour, but as I was preparing today, Wall Street was going crazy because there's a new therapeutic, they say, that we may have out in the next couple of months, and they've been testing it in one environment and over like 125 people, and it's working. It's working. So Wall Street's going crazy. And just to let you know how big of a deal this is, if you haven't heard the news this morning, Zoom's stock is down. Well, wait a minute. Why would Zoom's stock be going down right now? Well, Zoom's stock is down because this therapeutic is so good that people think, well, maybe we're going to get back to the new normal and it's going to be a little bit better than the old normal or the new normal that we thought the new normal was going to be versus the old normal, whatever. So there's an awful lot going on today. We have a ton of guests, and I couldn't be more thrilled to get started today by joining Alex Morris. He is the Advocacy Manager of the Michigan Bankers Association, and he is our first guest on the show today. Comes in via Zoom, and Mr. Morris, hello, welcome to our crazy little broadcast.
Good morning, Dave. Thanks so much for having me. I appreciate it. This is certainly an interesting time in the world today, and I think it's very appropriate to be speaking to some folks in Oakland County as your local officials work diligently to put in some effective screening orders for the COVID pieces.
Well, we are working hard, and we started talking to the fire chief, and at the very beginning we didn't know whether we were even going to be able to make all the 911 calls that we needed to make, and that worked out. Then we started talking to the hospitals, and it is tragic. I don't want to lose the tragedy of the situation, but tragic the deaths that we've had, especially in our communities here in Oakland County, and the number of people affected. But, we've had beds. We've had ventilators. It's been tight. We've had supplies. We've had, health officials putting their lives on the line. And then we have all these amazing people in our communities doing amazing things like making masks and manufacturing things they've never manufactured before. You see all the stories, but let's add to the very top of that list the bankers here in the state of Michigan, because, And maybe they're not everybody's friend right now because this Paycheck Protection Program has been a challenge to roll out. But oh my gosh, the job they're doing, they are just taking like thousands and nationally millions of companies and writing more loans in a week and a half or 2 weeks than they probably would write over a year. Alex Morris and the Michigan Bankers Association, to me, that's heroic, my friend.
Yeah, thank you, Dave. I appreciate that. Our members have been working extremely hard over the last 14 days. And unfortunately, you get an opportunity as a business owner. It's great to interact directly with your banker. Unfortunately, the way the SBA has rolled some of this program out has been quite a challenge, as you said. It's been a significant obstacle. As you mentioned, banks are working around the clock. And I truly mean around the clock. I'm getting emails at 12, 1, 2 in the morning from bankers who are working with their lending teams. And imagine in this COVID environment that we're in, bankers trying to do the significant amount of paperwork that is required for any type of lending activity with much of their staff at home. So it has certainly been a challenge, but they are stepping up to the challenge. They have been phenomenal. I spoke to a bank in the area today who believes that their PPP program will end up in about $50 million in lending, and they typically do about $25 million a year, and that is something that they stood up in about 14 days. So it certainly has been a challenge, but working with the businesses in the community to get capital deployed so that those businesses can continue to operate and survive has been extremely important, top of mind for us. And we continue to work with those folks to try and get additional dollars out. I'm sure that you're aware that the SBA has announced as of yesterday that the $350 billion appropriated by Congress has run out. We at the Michigan Bankers Association are working diligently with our members of Congress and other state trade associations, the Michigan Chamber and the Small Business Association, to do some serious communication and ask Congress to add some additional appropriations to that program. There are many businesses that still need help. In a 14-day period, the banks lent $7.3 billion just in the state of Michigan to over 25,000 businesses. But for every business that received those dollars, there is one or two that still needs help. So we're counting on Congress to reappropriate more money to continue to allow the banks to do that work, to connect with the businesses in the community and make sure that these folks are able to not only employ their employees, whether they're working or not, make sure people are on the payroll, but also to bring them back, as you mentioned at the top of the show. When we start to ramp things back up, it's incredibly important for these businesses to be prepared and have the access to the capital they need to get the ball rolling again.
Our guest on the program is Alex Morris. He is the Advocacy Manager for the Michigan Bankers Association. We are so happy to have him with us. We'll talk about process because there's a lot going on in process and a lot of details behind what you just talked about. But let's go back to the big issue today, Alex, if you don't mind. We got to get Congress to act here. And the thing is, it appears that they want to. It appears that the president, the Democrats, the Republicans, everybody wants to add more money to the Paycheck Protection Program and other programs. Not just that one, but the stimulus checks. They want to add some more money to that. But, they're getting in some back and forth. Well, do we put this in? Do we put that in? I hope they work their way through it. I know you guys are talking to them, and I would just urge everybody listening and watching today to get a hold of their members of Congress. I'm sure you're asking people to do the same.
Yeah, absolutely. It's vitally important that Congress acts. We were under the impression and hoped that there would be an opportunity for the Senate and the House to act without necessarily having to go back to Washington. Again, as you can imagine, many of them are home with the health crisis that we're dealing with, and bringing them back to take a vote is not necessarily ideal. There are a few there are a few clauses that Congress can invoke that if there is unanimous consent on something, they would not have to come back and vote. That did not happen. So we're more likely to see something occur at the beginning of the week next week. But I think, as you said, Dave, there is an appetite from all parties to deal with this. And we say at the Michigan Bankers Association, and this issue certainly applies, we're not a partisan organization. Our issues are not partisan, they're economic. And this is simply an economic issue that is vitally important. We are talking and concerned now about the health crisis, but certainly a poor economy affects lives as well in a longer term view. So we believe that that's vitally important. And yes, please, anybody on the line, make a phone call to your congressional member. Tell them that your businesses need help and your banks are standing at the ready to deploy that capital.
Alex Morris, Advocacy Manager of the Michigan Bankers Association. So, Alex, we hear the money has run out. But I know I'm an example, and you and I talked about my unique situation. I did get my number back. So the process is you apply through your bank, and then eventually it took a while, some sleepless nights, but you get this number back from the SBA that says you're good. But you still got to close with your bank and file all the paperwork. Essentially, you're borrowing money from your bank, and then they're getting backed up by the SBA or the Fed or the Treasury or whatever. So in my case, I don't have a signed contract yet, but I got my number. So even though they say the money ran out, there might be a lot of people in the pipeline, such as myself, that haven't gotten their money yet, haven't even signed their contracts yet, that at least I've got my fingers crossed that we're still going to see our checks in this round.
Yeah, that's correct, Dave. If you have an approved loan, the way the SBA has rolled this program out is the moment that they sent an approval to your lender, those dollars were earmarked and spoken for in the program. So when SBA says that there is no money left in the program, that doesn't mean that every dollar that was put in, all of that $349 billion, is in the hands of business owners. It means that it's spoken for. The banks are required by the program. Our members are working diligently to meet this requirement to close a loan within 10 days of getting an approval from the SBA. That is an incredibly quick turnaround for a lending process and for something that can be quite complex. And so they're working very diligently to make sure that those dollars get into the hands of the business owners within 10 days of that approval. But that is correct. If you've received approval, your dollars are earmarked, and you simply need to work with your lender to finish the paperwork, sign the loan, and walk away with your check.
And I feel so grateful because there are so many people that just couldn't get through the process. It was just so enormous. You know, one of the things I noticed, and we only got a couple of minutes left, Alex, but one of the things I noticed is that it seemed like, you know, and I'm with Huntington, and they're a bigger regional bank, and the Nationals, the Chase, those banks were all right there at the beginning, but it seemed like the community banks, the smaller community banks, were really getting in and helping a lot of people that were really, truly small businesses, and they were really stepping it up. And I'm hoping that on the second round, we'll have more banks, more lenders, more people, more institutions, so everybody can get through and get some help from their local banker.
Yeah, certainly. Many of our banks experienced some access issues to SBA system, which is something that Dave, as you can imagine, when you give a program of this size to the federal government and ask them to stand it up in 7 days, it's always very efficient, runs great. That's just a little bit of sarcasm.
I get it.
There certainly was some obstacles created by the federal government, but again, they were also asked to really make a Herculean lift, and they passed much of that on to the banks. Certainly, they're doing their best to get those out, and I guess the probably most important piece coming forward in the future, certainly there will be more banks involved. Small, medium, and large banks are currently involved. As far as we are aware, every bank in our membership is involved in the program in some way, shape, or form, and they certainly have had varying levels of success.
Alex Morris, Advocacy Manager, Michigan Bankers Association. Thank you for being with us. Anything else you want to add that might be helpful to the public as they are just trying to get through these difficult times?
Yeah, I think two things. Number one, keep your smiles on, have some faith. We are working diligently with Congress. We will get some additional dollars in this program. I'm certain of that. Also, keep in mind for all the business owners out there that the PPP, which we focused on today, is not the only program that was authorized in the CARES Act designed to help small business. There are a number of other lending opportunities that can get some access to capital into your hands to make sure that your businesses are running. That certainly is the purpose and the intention of the legislation, and the banks are doing absolutely everything they can to partner with you to keep our economy rolling in this state. Other than that, I would say as a business owner, look forward when you are filling out that paperwork for the PPP especially. Keep your eye on what those responsibilities will be 2 months down the road, so that you're gathering documentation and things like that that you can provide to your lender to ensure that that PPP loan actually qualifies for forgiveness through the SBA. We'd much rather see every cent lent in this program be forgiven than not.
Well, absolutely. Worst thing in the world would be to go through the whole program, plan that you're not going to pay that money back, and then have to pay the money back because you didn't do the right thing. Alex Morris, thank you so much for joining us. We really appreciate it. Great having you on with us today. And I guess we're going to have to amend that old joke about working banker's hours, because if you're working banker's hours right now, Alex, you're working a long day. I appreciate the effort that you and your members are putting in, and please give them our best.
Thank you so much, Dave. Appreciate the time, and go talk to your banker.
I will. As soon as I'm done, that's my next phone call. Barbara, hey, guess what? Dave Scott. She's getting tired of hearing my phone my phone number light up on her phone. So thanks, Alex. Good to talk to you today. Alex Morris, Advocacy Manager, Michigan Bankers Association. We are a local show, but there's a lot of issues that impact you right here at home that are still statewide. And in a moment, we're going to talk to Toby Voigt from the Michigan History Center. And they, from what I understand, are documenting this entire catastrophe, one Michigander at a time. We'll find out how that's going. And then in a couple of moments, we're going to talk to Tim Farris, Group Director of Upstream Investment Partners, see if we can figure out what craziness is going on Wall Street. Tim is one of our local money people, and we'll check with him in a moment. You're watching and listening to the Megacast. Dave Scott, Tyler Keefe, 6 feet away. You 6 feet away? Okay, very good. Get your mic on
Always
there.
6
All right, very good.
Always.
We will be back in a moment. You're watching Civic Center TV, civiccentertv.com, and listening on our great radio stations, 89.3 Lakes FM, 88.1 WBFH The Biff, and WAHS 89.5 Avondale Community Radio. We'll be right back.
I know you're concerned about the coronavirus, and we're working hard to combat its spread and keep your family safe. But we need your help, too. Wash your hands often with soap for at least 20 seconds. Avoid touching your face and cough into your sleeve. Replace handshakes with an elbow bump. Avoid large crowds or events, and if you're sick, stay home and call your health provider. Every one of us can make a difference limiting the virus's spread and keeping Michigan healthy.
Welcome back to the Megacast. If you're watching on Civic Center TV, you can see that we are using our handy wipes here, our Clorox disinfectant wipes, to keep our studio perfectly clean. Now, Tyler, these wipes, these are really wet. These must be brand new ones, because the ones that I've been using are not anywhere near as moist as these are. These are great. These are going to kill. Any COVID-19 that dare come in our studio is in a sorry shape here right now. So
that's not a good spot. Yeah, those are new wipes. We know we've been using them so much in here with the Megacast that we ran out.
How did you find new ones? Where
we
did
just
you
happened to have another pack.
What store could you have possibly gone to?
The deep dive into our cabinetry here at Green Media Center.
And we're going to talk to some of the water people here before the show is over. As long as we're talking wipes, just one reminder: don't put anything in your toilet that you've not already eaten first. That's just a simple rule. The wipes, they get clogged up in there, and then they get clogged up down the drain, down the road, and then you got to get the county, and municipal water people out to go clean that up, and Just imagine, it's bad enough having to plunge, forgive me for being so graphic, but it's bad enough to have to plunge your own toilet. Can you imagine plunging 10,000 toilets all at once to get those wipes out, Tyler?
No, and I really would rather not imagine that. So for the sake of our water resources workers, please.
Please. Joining us now, patiently waiting through all this toilet talk, is Toby Voigt of the Michigan History Center, checking him via Zoom. Hey, Toby, how you doing?
Good morning. I'm doing well.
Good. We can hear you really good. See, I like that picture. Is that a picture? I can't quite see the top of it. Is that downtown Detroit, or what is that? Oh,
Why,
yeah.
It sure is.
Yeah, that's great. Your sunflowers back there. We need that because it's going to snow if it's not snowing already right now.
Oh, it's snowing here in Lansing right now.
So Toby is with the Michigan History Center. And Toby, I got a full description here, but just why don't you make it easy on an old interviewer? What the heck are you doing on our show today? What are we talking about?
Okay, well, I'm glad to talk about it. So I'm the Community Engagement Director for the Michigan History Center, and we are the state of Michigan's museum and archive system. So we actually run 12 museums across the whole state of Michigan, plus the Archives of Michigan. And when this all started happening, we were, being the history experts for the state, we were getting phone calls of people asking us, how did the COVID-19 emergency relate to the 1918 influenza epidemic? And so we do what we do when we are in a museum. We went and looked in our collections. What did we have from that time period? And besides some government records, which is natural, the archives is the repository for state government records, we didn't have very much. And we thought, gosh, we don't really know what was going on in the lives of people in Michigan in 1918. And so as the organization that preserves history, we knew that we wanted to start something now for this pandemic, so future generations would have a rich collection of images and words and objects to really.
We're going to go into the museum 50 years from now, and there's going to be an exhibit on Zoom meetings. I can see it right now.
I know, and everybody's going to laugh at how quaint and antiquated that technology was. That's literally saving our lives right now.
Yeah, oh, that's how they had to do that Zoom meeting way back then. So you're collecting the stories of how we're surviving this terrible crisis. I'm sure you're collecting some of the tragedy, but also hopefully some of the positive stories as well. Are you wanting to connect with individual Michiganders to get their stories? Or how's this working?
Yes, absolutely. I think, one of the things that we try to do is capture the stories of everybody's perspectives in Michigan, all the diverse perspectives. So we're starting out, our project is actually 3 phases, more or less, mainly because we can't be collecting the stuff of history right now. We're all working from our homes. So but we didn't want to wait to start this. We wanted to be able to capture people's stuff right as it was happening right now. So we launched an online collecting website where people can submit their photographs or short videos or audio files of what they're experiencing right now. And we launched that last Friday, I believe. So it's been a week. And
I can make your job a lot easier for you. All you really need to do is just I'll send you a copy of today's Megacast, upload that, and you got the whole picture right there.
Absolutely. I was so fascinated by listening to your last guest with the, talking about the banking situation. Really interesting stuff. And this is exactly the kind of stuff that we want to capture. So please, if you guys want to submit your recordings, we'll be glad to archive that.
We would be glad. I was just kidding, but we would be glad to. There's an awful lot there. We talked to a lot of people that, and just some of the amazing heroic stories too. These kids that have set up a website to help other kids deal with the emotional aspects of this whole thing, and it's called Quarantine. I mean, how cool is that? Organizations of immigrants putting together face masks for people. I mean, people delivering food, first responders, medical workers. There's so many great stories. Toby Voigt from the Michigan History Center. I don't even know where you start.
Yeah, that's exactly it. So we're starting with collecting the stuff. And you make a really good point. And I talk a lot to folks who are in the news media, who are on the front lines like you, talking to the people who are making the history. So it's just natural that we be partners. Now I'm pitching. Please submit your newscast for us.
All right. Hey, Toby, is there going to be a new normal where we can get back in our museums here in Michigan and have any thoughts about, are you working on a plan yet, or is it premature?
We always have to think about thinking about what we're going to do to move forward, to do what we do, and that is to serve the public. And it's a little too early for us to know, for any of us to know when we can get back into the museum. But, we know what will happen, and we're really taking some time now to think about, museums have always been places you have to physically go to, and there's some barriers to going there. Sometimes they're a little intimidating. You think you have to be quiet. Well, if anything, this is helping us as a staff realize we are so much more than just the physical building, that we could be sharing great stories of the past and the present and making those connections using great tools like Zoom or our website. So in the short term, this has been very interesting for our staff to kind of embrace new ways of sharing all of the great resources, information we have that aren't tied to the building.
All right, well,
I think that's good.
Get to work on that little R2-D2 hologram that just displays in 3D right here in front of me. Because in a couple of years, that's the kind of stuff that we'll be able to do. We won't, we'll want to go to the museum because you just want to smell and touch and feel to the extent that you can. But you're right, it's all going virtual. Your world is going virtual. All of our worlds are going virtual. I think some good is going to come out of this whole thing. Toby, anything else to add? Because we got to scoot along.
Sure. No, I would just say go to our website, which is michigan.gov/MHC stories to learn more about the project and find the link to submit your stories.
Thank you very much. Let's keep in touch. Great job today. And, not everybody can pull the Zoom thing off and have it look so good. You did a good job. You got that all worked out really nice.
Why, thank you.
All right. Toby Voigt joining us from the Michigan History Center. We really appreciate her checking in. We're going to take a break. We're going to find out what's going on Wall Street. When I got here today, we understood that there was going to be a big rally because of some therapeutic medicines that maybe we're going to change the whole story. We'll find out about that in just a minute. We're going to check in with Tim Farris of the Upstream Investment Partner. He's our local Oakland County investment guru. We'll check in with him next. You are watching and listening to the Megacast.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
All right, welcome back to the Megacast. Dave Scott, Tyler Keefe. By the way, Tyler, you did a great job yesterday doing the broadcast on your own without me, and everyone told me it was a much better show than it would have been had I been here. So good job.
Well, thank you. I learned a lot from our usual host.
A lot of buttons over here, aren't there?
There are a lot of buttons.
A lot of...
You say it every day. I see it, and then you experience it yourself, and you know it.
There are a lot of buttons over here, Mr. Keefe. Even for a young guy with all your brain cells left, there are a lot of buttons over here. Megacast is on the radio on Civic Center TV. Well, not on the radio on Civic Center TV. On the radio on Lakes FM, the Biff, and 89.5 WAHS Avondale Community Radio. On TV on Civic Center TV. Imagine that. And also at civiccentertv.com. Today, our Facebook partner, the West Bloomfield Parks and Recreation Department. They got a zillion people on Facebook, so we are really glad to have them. So I'm driving in, and as an essential worker with my bandana on. I'll show you later on. And I'm hearing these reports from the financial community that the stock market futures were up like crazy. Now, I've not checked in since my call, but this was all over a therapeutic that had very, very high hopes. We need high hopes right now. To bring us up to date from a local perspective is our friend Tim Farris. He is a group director and vice president of Upstream Investment Partners. Tim, happy Friday. How you doing?
Happy Friday to you too as well.
I just got to remind people it's Friday because I don't know about you, but it kind of blends together when you're staying home for most of your day, you know?
It does. I made reference to that. So tomorrow's a day off.
It is. So, Tim, what's going on Wall Street? Maybe can you fill us in a little bit on what I heard this morning?
It's exciting. I mean, the market's a little bit muted versus where it was at this morning. The stock market opened up strongly this morning on news from a company by the name of Gilead, who has got a drug that's basically going to be used for the treatment of COVID. It's not necessarily the basically the cure that we're looking for, but this is definitely a way that they're going to be treating it. And what we're seeing is step by step, the economy is starting to take note to what's going to go forward. The market has always had a discounting mechanism, and it looks 6 months in advance. And right now, it's starting to price in the recovery, and that's been very exciting. So, what's funny about when this happens, though, is like you had referenced before the conversation here, we sit on Zoom. In a market like today, you're seeing a lot of the stay-at-home stocks go down and the traditional economy go up. So with people, when it comes to their investments, it's an important time for them to be cautiously optimistic and don't get bought into any headline in particular. With the Gilead drug, this is phase 3. So this is the final run. This is a legitimate, this isn't a home remedy that we're trying somewhere. This is an actual study that came out of Chicago, and they will actually have finalized results in May. So that's very powerful. What the extent of the drug is basically people that had extreme cases of COVID were given the drug, and within 1 week they had been cured.
Yeah, I heard they tested 125 people, and all these tests and everything the pharmaceutical industry is doing right now is absolutely amazing. They're getting this work done in weeks where it normally would take years. But they've been running this test in Chicago and with 125 people, and it's been going pretty good.
It has been, and this is generationally perhaps this generation's moonshot of being able to bring a remedy that quickly to the marketplace. And these are kind of the drugs that were already in place beforehand. So that's what's important to go through that. This is something that is in what has been traditionally phase 3 trials, which is your final run before you get approval or denial. So that's what's really been exciting.
Tim Farris is on the line with us. He's a group vice president for Upstream Investment Partners right here in our area. And Tim, I'm getting all of our guests confused. You were the guest that actually had the coronavirus. Is that correct?
Yes, as well as that is my kid's grandma has it and still is in coma right now, 3 weeks running on a breathing unit. So it's been pretty challenging as a family.
Well, our thoughts are with you and her and your family. And, it's just every time I hear a personal story like that, it reminds me of how serious this whole thing is and all of the efforts, then all the sacrifices that everybody is making. That's why we're doing it, to save your relatives, our friends, everybody we can. Best of luck to you. It's tempting, I assume, for those tuning in today to say, oh, we've got this pharmaceutical, we've got that situation, the president said this, the governor said this, the market reacts, and then people want to jump in and get into like day trader mode. What are your thoughts?
Definitely not the case. What we've seen over many, many versions of the same thing, that this is a process, not an event. Time will prove that this was a great buying opportunity. Like your last guest, when we discussed kind of the history of COVID, we jump back to 1918 and we talk about that. But what people forgot about is 1958, when the Asian hit America. In a matter of 8 months, we saw a recession very similar to what we're going through right now. That was actually here in Detroit, one of the most dramatic times for the automotive industry. That was when we saw roughly about a 35% decline in auto sales, roughly 50% over a couple of years. but it was a sharp decline that the economy bounced back within 12 months. The stock market was up and the economy was going to new highs. So I'm excited that history is something that rhymes, but it isn't necessarily, the tried and true. But we can kind of look at past examples of this and know that this will pass. And, from this, we will become a more efficient economy, and we'll see greater highs in the stock market.
Well, and yesterday, and we will talk about it on the show today. Yesterday, everyone's talking about the new normal, how we come out. President laid out their plan. Governors are talking about their plan. The Republicans in Michigan are talking about their plan. Local folks are talking about their plans. All these plans, but none of them work unless we have the solutions to keep people healthy, be it testing or whatever. And everyone wants to see that V, right? Everyone wants to see the V right now. We went down quick, we come up quick. But it can't happen unless we have the testing and the other things and the antidotes and the treatments that we're talking about today. But if all that lines up correctly, Tim, is it possible that we can come out of this thing in that V or with a surprisingly accelerated rebound? What are your thoughts?
Again, this is just an opinion. I believe that this process will take 13 to 18 months to fully work its way through the economy. We do not know that we're actually doing better until we've got a year-over-year comparison where we can say this is when it was bad last spring. Here's where we're at today. I know that when you look at a lot of what happened in 9/11, the airlines industry took 3 years to get traffic back to where it was prior to 9/11. Not to say that that's going to happen again, but it's those kind of things that are actually going to play within the economy. How many people are going to go to Sea Point in August? How many people are going to go to Disney next February? Those are bigger questions that haven't really been answered yet. So I can say this, that, there are opportunities continuously in the stock market, and it creates wealth in these kind of scenarios. And this is what's happened. Watershed events like this have happened before, and these are great buying opportunities in the bigger picture.
All right, Tim Farris, thank you very much. Best to you. I hope that all goes well with you and your family. Best of health to everybody. Thank you for checking in, and we look forward to keeping in touch with you in the coming days and weeks. He is a Group Director, Vice President, Upstream Investment Partners, checking in with us here on the Megacast. Dave Scott, Tyler Keefe. We're going to check in just a moment with Dr. Jennifer Lucirelli. Did I get that right? I believe so. Okay. Dr. Lucirelli is going to check in here in just a couple of moments. And Dr. Lucirelli is the chair of the Interdisciplinary Health Sciences Department at Oakland University and an expert on food distribution, and how things are going here in the county. We're going to find out about that in just a moment. You are watching and listening to the Megacast on Civic Center TV, civiccentertv.com, and on our great radio stations, 89.3 Lakes FM, 88.1 WBFH the Biff, and WA almost. It was almost. And WAHS 8. It's a dental thing. I just want you to know. Got a lot of teeth in there to work around. WAHS 89.5 Avondale Community Radio. Hang in there. We will be right back.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Welcome back to the Megacast. Dave Scott along with Tyler Keefe, and our next guest knows an awful lot about food here in the county and how we get it to folks. Dr. Jennifer, say your last name for me so I don't hack it up again.
It's Lucirelli.
Lucirelli, okay. Hard C. I didn't do a very good job of that. Dr. Lucirelli is the chair of the Interdisciplinary Health Sciences Department at Oakland University. Speaking of food, that's a mouthful, Dr. Lucirelli. What does that mean? What does all that mean?
So we take a different approach to training health professionals, where we recognize that Yes, we need people who understand the human body really, really well. So they take their anatomy, biology, physiology, chemistry. But we also know that humans are complex beings that function in society. So, I can tell you all day to eat more fruits and vegetables because they are going to help prevent cancer, but you're still going to choose the Pringles and the McDonald's instead because of the world that we live in.
So you study the fact that I eat too much pizza. I basically have that right?
I just want to recognize that, we live in a really complex world that influences every single decision we make. So we can make those decisions easier by environmental changes.
Well, my team was kind enough to hand me a quote you were recently quoted in the Oakland Press. It said, "Our emergency food players may have stepped up from feeding 300 families to feeding 3,000, but if each of them have to go to 4 or 5 different places, and we aren't helping to solve the current problem." Is that an accurate quote? And your thoughts, please.
Yes. So what we saw when coronavirus hit is that, one of the first things that families needed and were going to run out of very quickly was food. And so we saw a huge influx of people coming to the emergency food system, but each person was trying to, or I guess each organization was trying to serve more people instead of serving more food to the people that they were having to help over this situation. So people were going to the school system to get meals for their kids, to the senior center to get meals for grandma and grandpa, to the food pantries. And at the end of the day, it still wasn't enough. And so we know that with all of these increased face-to-face interactions, no matter how safe we're being, we're still increasing that risk of transmission in the community.
Okay, I get it, because if they're having to go to more places, then that is greater exposure. My notes say that Oakland University has established a food distribution site. Is that part of your solution, and can you talk about that?
That is. So one of the limits in the emergency food system was just the space that these organizations had. They didn't have increased warehouse and packaging space to get volunteers in there to meet this increased demand. And again, people were going to multiple locations. We said, if we could bring these groups together and combine all of the food that they have available in one location that's got a much larger footprint, we can serve more food to more families more safely. So we've turned the student center on campus basically into a food warehouse and packaging operations. It's really quite the sight.
So do people come there, or is that more of a distribution operation you've set up at Oakland University?
So it's more of a distribution operation. We have a series of volunteers who have signed up through the mycovidresponse.org website, and each volunteer delivery driver takes 4 or 5 households worth of food and drops it off right on their front steps. So they don't even have to leave their homes to have their food needs met. So that's really important for people who don't have transportation, who are either positive or have been exposed and are in quarantine, or the seniors and immunocompromised individuals that are just going to be at risk for really dire consequences if they were to catch this.
Dr. Lucarelli, what an amazing thing you're doing with that degree that you have. This is beautiful work, and you're getting food to people. Then you're delivering it right to people. That's amazing. Do you need volunteers? How's all that going? I imagine you're not calling Uber to get the food out. How's that working?
We are relying on a lot of volunteers right now. So yes, there's always a need for more volunteers, and anybody can sign up at mycovidresponse.org. And we also have a partnership with Gardner-White, where they are using their delivery trucks for some of our larger complexes. So we serve a low-income senior apartment complex that has 200 individual units. So for them, we pack all 200 boxes and bags of produce and milk and eggs into the Gardner-White truck, and then we have about 8 volunteers meet them on site and deliver to all 200 individual apartments. So
absolutely amazing.
Really, really heavily volunteer run at this time.
No, it's really cool. Absolutely amazing. You know, we just keep hearing about business after business, community after community, citizen after citizen, everybody pitching in, and that's why we're getting through this thing and hopefully flattening the curve and getting back to some kind of normal. Do you have any thoughts on that? We're going to talk a little bit later in the broadcast about how we transition back to whatever this new normal is going to be. Food's a part of it, but with your other expertise, any advice for our policymakers?
You know, I think that this has shown some of the inefficiencies and some of the vulnerabilities in our nonprofit systems. And I'm really hoping that the long-term outcome of this is going to be just a higher level of collaboration and coordination of services. You know, it's really cumbersome for people coming into this new position where they've never had to access social services before, to have to call around to 20 different agencies that are doing similar things and still not meeting a client's entire needs. So if we can centralize that and just end up with a much more humanistic approach, I think it's going to be a beautiful outcome from this tragic situation.
Well, that's a great point. And, those organizations are all doing amazing work. Let's give them credit. They've stepped up where they saw need. We have I could think of group after group after group doing great work, but I get it. And, it's a management, it's a technology thing, it's a logistics kind of thing. So, I'm really glad that you joined us today and that you're working on that. It's, it's another great aspect to this entire fiasco that we're all going through, and you're just making it better with your work. Dr. Jennifer Lucarelli, thank you so much for joining us, and please say hello to everybody at Oakland University and give them our best. And it's good to see that you and the other folks at Oakland U are doing what you can to help out our county and our state and our region.
Yes, thank you so much for talking with us today.
All right, thank you very much. There you go, Tyler, another amazing story. Who would have thought logistics? I mean, we've got, Meals for Wheels, Harvest, all these different other organizations, but, you got to get the food to the peeps.
You do, and it's interesting to get the angle of how that works and the deficiencies during this crisis that were in place in those working systems, and learn how organizations and groups throughout our area are helping to bridge that gap and help more people in the process with these organizations.
On this show, ladies and gentlemen, more Jennifers every hour than any other broadcast anywhere. We go from Jennifer Lucarelli to Jennifer Tucker. We will check in with the Executive Director of the West Bloomfield Parks Department in just a moment. You are listening to and watching the Megacast.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
And welcome back to the Megacast. Dave, Scott, Tyler Keefe in the comfortable confines of our Lakes FM studios. We don't have you can see there's no window in here. This is an acoustic environment, so we try to make it sound good. This is normally a radio, not a TV studio. Little did we know, we hit this button and it's a blizzard. It's winter out there. And you see our good friend Jennifer Tucker, the Executive Director of West Bloomfield Parks and Recreation via Zoom. It looks like Alaska out there, Jennifer.
I know. Don't you love Michigan? I mean, you just never know what you're going to get.
Is it the middle of April or what? Unbelievable.
I know. You know what it is? This is Mother Nature telling us just to hold on a couple more weeks, and then she's going to break out with the sun and the birds, and we're all going to be happy again, right?
I am so ready. I'm so ready for all of us to get healthy. I can't wait to go out and get a coney And I'd really love to play some baseball in one of your parks. So hopefully it won't be too long. We'll be doing all of that. Jennifer Tucker, Executive Director, West Bloomfield Parks and Recreation. Jennifer, thank you very much for sharing your Facebook page with us, and I appreciate that very much. We're going to talk to the folks from the DNR in a couple of minutes and find out what's going on with them. But a little bit more close to home, West Bloomfield and our other parks departments, how you guys hanging in there?
We are doing as fabulous as you can expect. You know what? We've learned a lot, and we're really pretty excited. We've got some really neat initiatives, and I'd love to tell you about just kind of some of the housekeeping, so to say, for our local park systems.
That'd be fantastic. Before you do that, though, just let me interrupt you for 1 second. Where are you? And I mean, it looks snowy. The sun is coming up. We're kind of losing the picture in the background. But where are you? And where are you?
I'm on my back deck.
Okay. You look like you're in one of the West Bloomfield parks. It looks so beautiful there. You got a nice place there.
I was contemplating lying, but I'm not a good liar. So
no, you shouldn't. You should be at home.
Yes.
That's what we're all supposed to be doing.
Right.
I assume you've been camped out at home for a while, doing your work at your house, right?
As much as I can, we sure are trying to keep that social distance and working out all the kinks and since we are still an essential service, we are doing what we have to do to keep the parks running for our residents.
Okay, so you have a list of things going on you wanted to share with us. Go ahead, please. Sorry to interrupt.
So, it's all right. So currently what we have is our offices will be closed till May 11th. And all of our programming will be postponed through May 30th, just so folks know. And at that mark, we will not be opening facilities yet, just because we don't know what that landscape looks like. Oh, I'm just losing the hood, Dave. Just forget about the hood.
That's fine. That's okay.
And so we'll be working on that and trying to figure out with some guidance from the county what that looks like as far as opening our indoor facilities. What we're really advocating is walking, hiking, biking. We want to maintain those social distances and try not to. We're definitely not allowing people to gather in the parks, but are trying to keep those gates open so you can come out and take a walk in the fresh air, because goodness knows we all need it right now. So we just need to hold in a couple more weeks and we can do it. A couple of other things that we're doing is we're continuing our Live with Lauren segments on Facebook on Tuesdays at 11 o'clock. And those that topic changes every week. So you can catch Lauren Azuri, who is our naturalist at West Bloomfield Parks and Recreation, and she does a fantastic job. We also have we're also doing some nature breaks with our other nature staff, and you can also catch those on Facebook as well. One thing that we're doing that is kind of new to us is we have our Connect facility, that is where our senior services are contained. And right now, obviously that facility is closed. We have a Connect senior support line set up. So folks that maybe need a little social interaction or just want to reach out and actually hear a human voice, or may be living by themselves, or, we have that line set up for them, and they can call it at 248-451-1910. And that also is on our website. So please take advantage of that. If you just want to reach out, have a conversation, maybe there's some information we may have for you, or some sources of information, or if there's something we can connect you with, we will definitely do that.
All right. Well, I really appreciate all the information and everything you do. We got to go. I can give you another minute or so, but I just got to say I'm cracking up here watching you, because this is the best snowy media event that I've seen since Amy Klobuchar's press conference. I don't know if anyone saw that one. She announced her candidacy in a blizzard, and there you are in the snow today. So what else you got, Jennifer Tucker?
Just a couple of things just for our residents. We are continuing to maintain our parks on behalf of our resident. We are an essential service. So if you do see Our staff, we all are maintaining that social distancing, but there will be work happening in the parks, might even be right down to that mowing. We are allowed to do that. So please don't get upset with us. We don't use a private contractor. All staff is in-house.
All right.
So I
you
know
can come
that's
over.
a touchy subject right
You
now.
can come over and cut my grass too, because it's getting not only my grass, I can't get my hair cut. Thank goodness for a little bit of.
I have a sheep shearing background, Dave. I'd be able to help you out.
Jennifer, we got to go. Thank you very much. Thanks for sharing the Facebook page with us. Thanks for your great work. Listen, getting out of doors now, it's a little complicated knowing what grass to cut, what boat to drive. But we will get through all this, and it will get a lot easier. And I'm glad next time we talk, we're going to talk more about the future. Getting back to the new normal, what we're going to work on as we're coming out, like all different aspects of government are working on that. Thanks for stepping outside. You could be working for the Weather Channel next week. You could send up a tape of this, and you're going to be like the Weather Channel reporter out there covering hurricanes or something. That's awesome. Thanks, Jennifer.
Okay. Have a good day.
You too. She is Executive Director of West Bloomfield Parks and Recreation on her own deck in a snowstorm here on the broadcast. We're going to take a quick break. We'll be right back, running a little behind schedule, but we will talk to our own medical expert. He is the Dr. Sanjay Gupta of the show. He is Dr. Jamie Taweel. And can we open things back up? What do we need medically? What do we need to get done? What other input and experts, what other commentary and expert opinion do we need from our medical community to open things back up? We're going to get a local perspective on it next. You are watching and listening to the Megacast. We'll be right back.
The Centers for Disease Control and Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
Thank you very much for joining us on the Megacast. It's a crazy situation we are in right now. Joy, I'll explain what I'm talking about. Joining us on the line now is Dr. Jamie Taweel. He is an internal medicine specialist right here in our own backyard. How's it going, Doc? How you doing today?
Going well. How are you?
I'm doing good, but we just had a little dilemma, and our viewers could see it if they were watching during that break. I'll show them right now. So I was trying to have Tyler help me with my laptop and type up some information for the segment. Okay. I went to hand him the laptop to do it right now, but I can't. It's like I'm getting in a 6-foot space. Plus, I don't know how to clean it up and wipe it down. And just, it's a complicated world we are in right now, Doc.
Oh, man, it's not good.
So thanks for joining us. I just want to ask you a couple of questions based on the news that we have. We heard the president yesterday say that we've got this 3-phase plan to get back to our new normal, one step at a time, and it's all going to be driven by the medicine and keeping people healthy. I think that's going to, continue on through the state and our local communities. I don't know if you heard that yesterday, but do you have any thoughts about that? Because to me, it was reassuring to hear that as much as I want to get back to normal, we're going to be doing this in a way that is under the advice of the medical and scientists and those experts.
I think that's incredible. I would hope that it's purely driven by that, because we're the ones that are the scientists are the ones that are trying to basically keep everybody as healthy as possible. So I think if they're going to take that advice, that's fantastic. What I would be concerned about is looking at it from a purely economic standpoint. And again, while I do agree that economics should play a bit of a role in there, but we need to consider lives first. And so I'm relieved that he's deferring a lot of that more towards the medical community, and let's just hope that that continues.
Well, and let's hope that we have the courage to do that all the way through, that we can find the answers. Are you hearing or seeing anything in your practice, any indication right at the grassroots level, in a doctor's office, right here in our backyard? Forget all the numbers for a minute. Any indication things are getting any better?
I think so. I've had a couple of patients, I've had a few actually that have tested positive, but have had relatively mild courses and have been able to socially isolate and not have to go to the emergency room. And I've had all the way up to patients that had required to be on ventilators. So it's I'm following a lot of it, but it looks like it's been a little bit. I'm seeing some promising things. I haven't had, thank God, knock on wood, but I'm also hearing a lot of other things. So I think my experience might be a little bit different than others.
Dr. Taweel, we heard yesterday that we've got more testing centers around Metro Detroit. Testing will be a big key of coming out of this crisis. Everyone says that we got to test. We got to test heavily. Now, there's other metrics that they talked about yesterday. Just watching other infectious disease as a leading indicator of the coronavirus and other things, but we got to test. We got to figure out what these metrics are to be able to come out of this. Do you have any thoughts on any of that?
Absolutely. The thing is that if we're going to go based on, determining whether or not we're going to reopen the economy, so to speak, based on the, information that the medical community is providing, we're going to need as much information as possible. So the amount of testing that we can get, the more that we can start to get ideas of where these things are, we can also get a better idea of the epidemiology of this particular virus, how it's getting spread, different ways in that it's getting spread. We can start to look for hotspots. This can really guide whether or not we're able to open things up sooner or later. I think if we're doing that with limited amounts of information based on what, let's say we don't have enough testing, then how are we going to know whether or not we're doing well to the point where we can open things up? So testing definitely is a huge role in all of this.
And one of the things I was trying to sort out today, and I was unable to really get it from the information I found online, is we see the number of cases continue to rise here in Michigan, but we don't see the number of tests. They don't seem to publish if we're actually testing more people. We just opened up a new testing center in Oakland County. Theoretically, there's more testing. Don't you really need to look at the number of people that are getting tested, to look at the results of those tests, good and bad, and look at the people that are passing away, unfortunately, the people that are coming out of the hospital? You just look at one metric and it can be, used for some political agenda. That's what I'm concerned about a little bit.
Yeah, I see where you're coming from with that. You also have to bear in mind that the testing in and of itself is based on particular criteria that you have to meet. So they're not testing just anybody that wants one. They're testing people that have distinct symptoms. So that also can skew some of the numbers if you're looking at the population as a whole, because now you have asymptomatic people that are not getting tested, and that can also impact your numbers as well. You have to look at it from all of those points of view, and it becomes, you also have to know people. You're right. You have to know people that have gotten tested, whether or not they're coming out of the hospital, so that we can have a little bit more accurate data in terms of recovery. We can have more accurate data in terms of death. It's difficult to be able to get these numbers out there when we don't have enough people getting tested. So I think testing needs to certainly get pushed.
Yeah, we're seeing some information, some talk yesterday, that this Abbott Labs test and some of the other tests may be we may be able to implement them at the office. I mean, is that even conceivable that the head of the HR department could have some testing unit, or is that just a crazy notion that it needs to be in the hands of a professional, health professional?
It depends on the type of test. I mean, if it's a blood draw, then I think it would probably be at least in an HR type scenario where there's a nurse able to draw blood. Or I think in any situation you could have a nurse doing these tests if they're going to be very simple tests indeed. You're talking, I assume, when you say the office, you're talking not medical offices, but in the workplace.
No, I mean, I heard some reports yesterday. Well, you might be able to go into the office and get a test once a week. You work for a big company, they might have a nurse right there and just get a test right at work. Is that conceivable as we branch out testing in a big way, or is that just you're the doc? I don't know. Is that impossible?
It's not impossible. You can always do things like that. But the question is the benefit of that. If you're going to have a guy who's going to go all the way to work, walk in the office, walk through the office, and potentially expose everyone in the office just so he can get a test to find out that he's positive 3 days later, that might be a bit of an issue. You might be able, that might cause more problems along the line. But if you are able to get everybody tested in a way where it's going to be safe, I mean, for most medical offices, if there's a suspicion that you might have it, they're going to test you in the, initially we were recommending to get testing in the parking lot. We don't want them to come in and expose other people. So bear in mind that exposing other people while you're trying to get your testing is going to be a big issue.
All right. Well, we're going to have to zip along. Thank you for your time. Two final really, really quick questions. There's a little dispute yesterday between Dr. Gupta and Dr. Oz. Which should I go with? Is it Dr. Oz or Dr. Gupta?
I'm going to stick with the home team. He graduated from Michigan and he's from Novi. I like Dr. Sanjay Gupta.
All right, we go with Gupta. And then finally, a therapeutic was just getting everybody very excited today. Wall Street opened up big because of it. And they're out testing in Chicago with 125 people getting really good results. Should we get excited about that, or would the medical community say, that's only 125 people? We need a little bit more information.
Well, if I'm not mistaken, they're in, from the best of my knowledge, they're at phase 3 trials, essentially. They're pushing this along quite rapidly. I think we should always remember that drug studies, trials are what determines the efficacy of the drug, not anybody else, not the markets, not politicians. I think when they get the data that supports the use of the drug, then I definitely think we should be excited about it. From what I'm reading, it looks promising, and it is an antiviral. So hopefully it can, again, always any little sliver of benefit is going to be what you want. So if it has, from what I'm looking at, it looks very promising. I'm hoping that it will continue to be such, but I would say just hold hope until the trials are completed, because you never want to rush to judgment on anything. It could end up having potentially bad side effects, or you're going to be, worse yet, have potentially reckless behavior, people thinking, oh, there's a treatment out there now, I'm going to go out there and get exposed.
We are not there yet by any question. Dr. Taweel, thank you very much for joining us. Dr. Jamie Taweel, internal medicine specialist from right here at home, and we appreciate you joining us again today in the Megacast. With short notice, we'll be in touch.
Thank you. Anytime.
All righty. We're going to take a quick break, and we'll be right back. We have a loaded hour of guests. You are listening to WAHS, Auburn Hills, 89.5 Avondale Community Radio, 88.1 WBFH, Bloomfield Hills, and 89.3 WBLD, Orchard Lake, West Bloomfield, Kego Harbor, Sylvan Lake, and watching on Civic Center TV and on the Facebook page of the West Bloomfield Parks and Recreation Department. We'll be back in 30 seconds.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
All right, thank you, David Coulter, and thank you for tuning in. Dave Scott, Tyler Keefe here in our Civic Center TV and radio studios, actually in the Lakes FM radio studio today. And we thank you for tuning in to the Megacast all around Oakland County. We started in West Bloomfield, and my, have we have grown. Thank you to Lakes FM in West Bloomfield, the Biff in Bloomfield Hills, and in Troy and Avondale on the east side and points behind or beyond WAHS 89.5 Avondale Community Radio, and on Civic Center TV. And patiently waiting for us, we're running a little bit behind, is Sergeant Megan Lehman of the Troy Police Department. And Sergeant, thank you for joining us via Zoom. You got your Zoom setup working pretty good there, Sergeant. How you doing today?
I'm doing well. How are you?
We're doing fantastic. Thank you for joining us. I appreciate you taking time. We are covering more and more communities on this show, and it's really good to talk to our first responders. I spend an awful lot of time in Troy. One of my offices is there, so your folks do a great job for us. We really appreciate it. Thanks for joining us on the show. How's it going trying to police in this crazy time?
Well, it's definitely different, but we are staying pretty healthy and able to handle the amount of runs we have coming in, and our citizens are a big part of that. They are staying home and, voluntarily complying for the most part with all these, the executive orders, and everything is going pretty well all in all.
I could tell you that it's amazing. The traffic is down so much I can almost make a left turn off Big Beaver at almost any time of the day right now without much of a headache. There aren't many cars out on the roads right now. People are really doing an amazing job.
Yeah, traffic is a big part of what we do in Troy. We have a lot of traffic coming in through the day. Our daytime population goes way up. Car crashes are way down. We took a look at the data at the beginning of this week, and we were very happy to see crashes down dramatically. We do have officers out there for people that are going to drive recklessly. We are out there. We will pull people over if we need to for that very dangerous driving. But all in all, things have been great in the traffic department too.
I've been traveling around the community very carefully because my birthday was in March. And the Secretary of State's office is closed, and I have an expired tag. Thanks to the governor. I'm legal, but that was really scary there for a couple of days because we couldn't get in and get it done. And there's a bunch of us that I had recent birthdays that couldn't get our tabs up to date. And I appreciate that. There's a lot of other little adjustments you've had to make just to understand where people are. And you don't want to just pull everybody over and arrest them and throw them in jail because they're just trying to get through their day-to-day, right?
Right. So, our priority every day is public safety, but now more than ever, we're going to take people into custody when we need to and when we have to, meaning actually we'll make a physical arrest. If you're out there doing a misdemeanor, we may write you a citation and not take you into custody. It all depends on if it's a public safety issue or not. So as always, domestic violence, if you did a domestic assault, you're going to jail. Drunk driving, you'll be going to jail, and other serious offenses as well.
Well, and thank goodness, we don't want drunks on our road. We don't want people running around doing the things they shouldn't be doing. But what's your observation? Have people been doing the best they can to comply with this very difficult set of rules we're living under now?
Absolutely. I was out driving around yesterday in Troy. We're seeing people staying home. Businesses that are supposed to be closed are closed for the most part. We are getting calls here and there from citizens about businesses that they think should be closed, and we've gone out and done some checks. The few violations we have found, for the most part, we've gotten some voluntary compliance. We will get a call here and there about people playing tennis and things like that, maybe on the park equipment, our playground equipment, like everywhere else in Oakland County is closed. But all in all, we're very pleased with how our citizens have come together and just, complied with the executive order.
How is your department doing? Certainly in Detroit, we've had a problem with a lot of officers that have gotten sick, and it's happened in other communities. Troy, right in the middle of Oakland County, one of the hardest hit communities in the state of Michigan. How are your officers doing?
So for the most part, our officers are doing well. Our administration got on this pretty early and tried to put some mechanisms in place to make sure only healthy people were coming to work. People were, known officers and are non-sworn. You should stay home if you're sick. And now we have a different schedule in place where officers are working more days in a row, but then they're off for more days as well, kind of to get that time out of the office and reduce the amount that you may be exposed. So it's working out very well for us. Some people are doing a little different jobs, but everyone's kind of pitching in and rising up.
Sergeant Lehman, I like that. That's a really good idea. That's like some new normal thinking. These are some of the things that all of us might have to do. Adjust our work schedules. Some people do this, some people do that. Maybe we change a little bit of what we're doing to make sure, if you're not writing as many speeding tickets, then maybe your officers can focus on some other things and helping people out in the community in another way. So, we all got to adjust right now. So I get that. Anything else that's coming to mind that people have been asking you about, or anything that you want to share with the community today?
No, I mean, we appreciate the support of our citizens. They're, coming out, people are giving us food, which is greatly appreciated. Just those small gestures, people waving to us, we appreciate the support in this time. We're grateful for the citizens of Troy and appreciate the opportunity to talk to you about it as well.
All right, Sergeant Lehman, thank you very much. One of your dispatchers, I don't have her name in front of me, but she made a big splash in the news. We didn't get a chance to chat with her, but, she was, I believe, making face masks and helping people out. There's been so many great stories like that all around Metro Detroit of individuals helping out. And, I'm sure as you look at your team, you just got a ton of people that are doing things like that. Generally, I think police officers get into the business because they really want to help the community.
Absolutely. And they're the kind of people that want to be involved in a situation like this. So, you don't want to be on the sidelines when there's a major worldwide emergency going on. So that officer is actually one of the officers in our traffic safety unit. She's an officer on the road that's out handling crashes and writing tickets. But she told me that she was looking for a way to help. She couldn't help the community in the way that she normally does, and just felt that need to get out there and do that. So that was fantastic.
Yeah, really cool story. It's kind of funny you mentioned that, though. I didn't think about that. I like what you said, and we'll run along in a moment. But Sergeant Lehman, I kind of like that. You're right. I mean, if you're a police officer, this is like the Final Four. If you're in collegiate basketball, right? This is the big thing. You want to step up. If you're a basketball player, you have that dream about making the final shot at the end of the game. This is the time when we really need everything that our police officers can provide to us. So it's good to hear that. That's a great message that they are committed to wanting to be there to help out during a tough time.
Absolutely.
All right. Thank you, Sergeant. Appreciate it. Thanks for joining us on the Megacast today. Best to you.
Thank you. Thanks so much.
Sergeant Megan Lehman joining us from the Troy Police Department right here on the Megacast. They're doing a great job, Tyler. I'm in Troy every day. I get a chance to go in West Bloomfield and Birmingham and Troy, just on my flight path, and they're doing a fantastic job. I can tell. I hear a lot of sirens, and I know it's, a lot of folks getting to the hospital, but, every time I hear one, I think, well, those guys are doing a job to keep us all safe.
They are, and it was interesting talking yesterday with Chief Flynn and their department about how they're working in dispatch, and it is Dispatch Appreciation Week this week, how they are working to make sure that they're sending the first responders out into a safe situation by giving them the knowledge that they need before they go so that they're able to keep themselves and the people that they're serving safe. Okay, we are going to take another quick time out. We are going to check in with Scott Pratt. He is the Chief of Field Operations. Yes? We have Ron Olson on with us in place of Scott Pratt from the Michigan Department of Natural Resources.
Oh, is he going to join us on Zoom or on the phone?
He'll be on the phone with us.
Okay, very good. So okay, great. So we got Ron Olson, the chief. That's what it says right in this sheet of paper I didn't read before. Ron Olson will be joining us, the chief of the State Parks, Michigan Department of Natural Resources, via phone. When we return, you are listening to the broadcast here in Oakland County that's got all of your coronavirus COVID-19 information. It's the Megacast on WAHS 89.5 Avondale Community Radio, 88.1 WBFH The Biff, 89.3 Lakes FM, Civic Center TV, civiccentertv.com. And speaking of parks, we are also in the West Bloomfield Parks and Recreation's Facebook page, and we'll be back in just a moment.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
All right, welcome back. It is the Megacast right here on 89.3 Lakes FM, lakesfm.com, Civic Center TV, civiccentertv.com. That's where you should go to watch the broadcast if you can. I think you'll find that you'll like it real nicely there because it's in high definition. We also invite you to listen on our radio stations if you're not there already. 89.3 Lakes FM, 88.1 WBFH, the Biff, and 89.5 Avondale Community Radio. Tyler Keefe, you're doing a great job over there hitting all the buttons. Did a great job yesterday in the show, and I want to thank you for that. And joining us in just a moment, when I get him on the line, will be Ron Olson, Chief of the State Parks from the Michigan Department of Natural Resources. Have you had an opportunity to get out and enjoy any of the parks, get outside when it's not snowing like it is right now?
You know, I've been kind of in a holding pattern where I've been waiting for a day where it's not too chilly and it's nice and warm. I can go out for a nice walk and enjoy the scenery. Take a breather and read on the at the parks and watching over the lakes and all that. And I keep getting into this little pattern where I try to do that, and then it's a rainy day, or it's snowing and it's way too cold and no one wants to go outside. So that becomes an issue. Or I have a day where I just end up being really busy and it's a perfect day. So I'm waiting for that opportunity. I can't wait for it, Dave.
All right, I'm ready too. I've really enjoyed getting out, and when you get stir crazy, just going for the walk, around the neighborhood makes a big difference. That's good. A little bit better if you can get to one of the great parks in the state of Michigan. We have an amazing set of local parks in our communities. We've talked to folks like Jennifer Tucker, the Parks and Rec Department of West Bloomfield, often here on the show, but joining us right now is the chief of the state parks here in the state of Michigan. His name is Ron Olson from the Michigan Department of Natural Resources. Ron, welcome to the Megacast.
Yeah, thank you very much.
Well, thanks for being here today. So we are here in Oakland County, and for the past almost a month now, we've been doing this local radio show, television show, putting it all over social media. A ton of people have been tuning in to try to, just try to get together every day and see how we're all doing and then get the latest coronavirus information. And I'm sure even at the Department of Natural Resources, there's an awful lot to keep an eye on and a lot of planning and things going on surrounding coronavirus. I assume, Ron Olson, you've had your hands full.
Yes, we have. We have all of our pretty much all of our outdoor opportunities, trails, state parks, and boating access sites available with some restrictions for sure that have been driven by the executive orders and things like that. But we're fortunate to have been identified in the executive order as a essential opportunity for the public to provide a sanitary, safe place to go out and recreate, provided that people take heed of the social separation and keeping their distance and go out and staying away if you're sick, but still having those opportunities to have an alternative to being inside.
Ron Olson is the chief of the Michigan State Parks and the Michigan Department of Natural Resources, joining us via phone right now on the Megacast. Dave Scott here. And so, Ron, it's, we've been talking on our shows what a good idea it is to get out. And it's been so good that many of the facilities, most of the facilities around the state have been available and open, and people have been using them wisely. We did see a little problem with one of the national parks, Sleeping Bear. They had to close it down because, people weren't keeping their social distancing. But would you say that's more the exception than the rule?
Yeah, at first, it seems like a long months ago now, but it was 3-4 weeks ago when this whole thing started to really ramp up. We saw people going out and not observing the distancing, but over that period of time, we've experienced people more and more have heeded that separation. And a couple of weeks ago, we started even enforcing it, and we had some individuals at a few areas that didn't respond, and out of I think our enforcement people have had 300 or 400 contact, shall we say, and I think there's only been 3 or 4 tickets written to people that were, because it's a civil infraction if you violate that separation. But by and large, it's been generally well managed by people individually at state parks. We've had a few problems at a few areas where people congregate to fish. For example, Tippy Dam Recreation Area up on the Manistee River. We had to close that because there were hundreds and hundreds of people trying to catch steelhead salmon in a very constricted area, and it was very difficult to maintain separation. And we did have some challenges at some boating access sites where we had a lot of people wanting to get their boats out and whatnot to launch to go fishing, and that was some challenge. But generally speaking, people on trails and otherwise have been respectful of one another of late, even including very busy parks like Belle Isle and Detroit that we manage. And we just got update reports yesterday, and that the staff by and large and our enforcement folks are saying people are, while there's a lot on a decent weather day, there's people have been separating themselves very well too. So that's positive in that regard.
Well, and that's going to get more and more important as the weather gets nicer. I mean, for goodness sakes, it's snowing today in the middle of April, but it won't be for long. It's going to warm up again this weekend, and before you know it, we're going to have 70-plus degree days. And here in Michigan, it's just a tradition after a long, tough winter, and it's been a really tough one this year. First thing everybody wants to do is get out and enjoy the parks and recreation, and it's going to be different, especially soon. But no reason why people can't get out as long as they follow the rules. And I'm not going to debate on this show whether the rules we have are the right ones or the wrong ones. They just are what they are. In short order, they're going to be changing, though. Are you working, Ron Olson, in the Department of Natural Resources and at the state parks? Are you building plans and putting advice together for the governor so these rules are rules that we can live with and work with as we get back to our new normal?
Well, exactly. Yes, we're preparing right now for we call it reversing the triangle, meaning that as the triangle has gotten narrower with restrictions, and what would that look like to reverse it, and what would be the time frames and things like that. Once the order is, the parameters of the order start going backwards in terms of releasing some of the restrictions. And so we're preparing for that right now, and what that might look like once the governor and their advisors determine that lifting the orders or altering or changing them, and we take our lead from that, of course, and follow that accordingly and stay within the guidelines of that. But there's discussions that'll be going on robustly in the next few weeks to look at those kind of things.
Yeah, I think one of the biggest challenges, and it's got to be difficult, I'll just be honest and direct, it's got to be difficult for your officers who are trying to enforce these rules when you get something that the public is a little bit concerned about right now, and that's, the distinction between a motorboat and a sailboat. And I'm sure there was a really good reason for that. But, I think most people look at that and they kind of scratch their head, and it's got to be tough to enforce. People just want to get out on the water and fish and enjoy their summer. So, I salute you and your team. It's not their job to make the rules. They just have to enforce it and be out there on the front line.
Yeah, and yes, exactly. And it's challenging, and we have some very passionate people that love their activities that they do outdoors, and certainly fishing right now because of the early walleye fishing and things like that in the steelhead. There are a lot of passionate people, but yet at the same time, there's a balance between, pausing what you're doing, staying closer to home to recreate, things like that, and alter your choices, because in the long run, everybody wants this, the tide to get turned on this whole reason why this is all in place in the first place.
Do you think that we're going to get at a situation this summer where things get back to some kind of normal, where we are out on power boats, we are out on our lakes? I suspect we're going to be keeping our distance this summer, but do you think we can get closer to what a Michigan summer normally looks like?
Well, let's just put it this way: we remain optimistic that things will improve. That if things go the way that people say, eventually the line will flatten out, and things will start to reverse as we described. But I'm hopeful and optimistic that at some point this summer the people will be able to resume their lives, and that includes these outdoor recreational pursuits that everyone enjoys in different ways. But I do think that people will be mindful of the things that, whether it's washing your hands or whether it's keeping some distance and avoiding not going out and if you don't feel well or you're sick or something. And so I think that'll, I suspect, linger for some time. But I also think that, what we need to do is remain optimistic that things will come back and things will resemble a normality, whatever that is for people, and, at some point.
Yeah.
And hopefully it will be with the weather decent for folks in the summer and beyond. Because in Michigan, a lot of folks like the late summer and early fall as well. But all I can say is we can remain with optimism, but it takes steps to get there. So,
Ron Olson, the chief of the State Parks Michigan Department of Natural Resources, we thank you very much for joining us here on the show. So
yes,
generally this time of year, and I'll let you go in a minute, but generally this time of year we're making our reservations. If you're a boater, you're reserving a boat slip maybe somewhere up in northern Michigan or along the Great Lakes somewhere. If you like to camp, you're getting that favorite campsite. You maybe a long time ago made those reservations. Can people still get on the state park reservation system and make reservations for plans for this summer, or
Yes.
is that on hold?
No, you can make reservations after May 1st because that's our theoretical time frame right now, because part of that is we don't know what the orders will be after April 30th. But, yeah, people want to plan for the, summer, whenever that is, that reservation opportunity is there, and you can reserve 6 months out from the date that you go online or transact that. But we would encourage people to continue trying to make their plans and that sort of thing.
So, and if you do make a reservation, you put some money down. I think some of those reservations you got to put deposits on. If the event's canceled, would you get your deposit refunded?
There would be a procedure for people not to be penalized if the orders for some reason extend and impact their reservation. But right now we're telling people that do have reservations beyond May 1st to sit tight and wait and not panic or cancel prematurely and take a penalty. To just wait and see how this is going to play out, and because they might be disappointed if they cancel, lose their spot, somebody else takes it, and then you're out. So that's not. We prefer people to exert patience.
All right, Ron Olson, we appreciate that. I'm sure you're working on plans. Maybe we'll have to, split up these campsites and go every other campsite or every other boat slip or do something this summer.
Yeah, we're looking at all kinds of scenarios like that as we would start working our way back into all of those things.
Well, that's good to know. I mean, as a final question, could you talk anything? Could you share any of the planning or the scenarios that you guys are looking at this point?
Oh, we've got all kinds of different things of what that ramping up would look like, and nothing's solidified, but we know that it does take a little while to get back in order. We have to make the proper preparations for bathrooms and things like that. So it could be that I'll just refer to it as a kind of a rolling start back, and what that means, we're still trying to figure out how that would work and for what period of time. So it's a little early to start suggesting that, but I can say that some kind of a rolling in scenario is likely.
Well, that's good to hear. Ron Olson, thank you very much. I have a bag of marshmallows, some graham crackers, and some chocolate bars just sitting, waiting for that campfire this summer. So there's nothing better than up north in the state of Michigan in the summertime. We're looking forward to hopefully enjoying that this summer, and thank you for joining us here in the Megacast today.
Yes, sir. Okay, thank you much. Bye.
Thank you. Ron Olson is the chief of state parks here at the Michigan Department of Natural Resources. He's got his hands full, and I just hope the governor is listening to the experts, and that we get some plans in place, Tyler, that make sense. I mean, listen. What's the difference between a powerboat and a sailboat? I don't want to get political here, and I know she's got her hands full, but I can understand how people get frustrated over that, and some of the other things. It's not easy to write these rules, but, hopefully they'll come up with some better ones for the summer.
Yeah, hopefully, and I think as this process goes on, I think the state government, the governor's office included, will look at better ways to approach this and what things can be a little less heavily regulated and a little more relaxed. Especially with this outpouring of dissent regarding boating and recreation and whatnot. And it's good to see that organizations are also planning for if and when that does happen. How are they going to execute that while also maintaining the safety of the people that patronize their parks?
Good to hear. Speaking of a guy who's got to be working on a lot of planning, Jim Nash, the Oakland County Water Resources Commissioner, will check in with us in just a couple of minutes to talk about water. I did see a press release last night from the state of Michigan making sure that our water systems were turning people back on that were shut off due to financial issues. We'll talk to Jim about that, making sure that no one's taking any of these and putting them down the drain, and a whole lot more. It is the Megacast. My name is Dave Scott. That's Tyler Keefe over there. We'll be back in just a minute on our great radio stations and Civic Center TV, Channel 15, Channel 99, and on the Facebook page of the West Bloomfield Parks and Recreation Department. We'll be right back.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions, so I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Welcome back. Megacast on Civic Center TV, civiccentertv.com. Great radio stations covering almost all of Oakland County. 89.3 Lakes FM in the West Bloomfield, Farmington Hills, Commerce Township area. 88.1 WBFH in the Bloomfield Hills and Pontiac area. And WAHS 89.5 Avondale Community Radio. The transmitter's right at I-75 and M59 and covering an awful lot of Oakland County. We thank them for supporting our broadcast here, being a big part of it, and we thank you for tuning in. So we're here to share the latest information regarding COVID-19 and this coronavirus outbreak. So many different aspects of this. How we come out impacts, of course, decisions that are made at the state and the federal government and our local communities. In a minute, we're going to talk to the mayor and city manager, one of the smallest towns in our area, Sylvan Lake, and see how they're getting ready for all this. But right now, we are delighted to be joined via Zoom by Jim Nash. He is the Oakland County Water Resources Commissioner, and he joins us here live in the Megacast. Mr. Nash, Commissioner Nash, thank you for joining us.
Well, I appreciate you having me.
Well, thank you for being with us. So, a couple of things. First of all, I did see a press release from the state of Michigan that said we want to do everything we can to make sure that we're not shutting water off for anybody because they can't pay their bills right now. And if your water was shut off, we want to get it back on. It's important people have their water. Could you talk about what's going on the front line on that?
Absolutely. My office operates and maintains for a bunch of communities, about 15 communities in Oakland County. Pontiac, Farmington Hills are our biggest. We do Commerce Township, Orchard Lake, a bunch of smaller communities, Oxford. So when we're operating, maintaining all this stuff, we want to make sure that we're doing it properly for everybody. And all the communities that we operate, maintain, a couple of weeks before the governor did that, we did the same thing. We went ahead and told everybody that had their water shut off for non-payment that we would turn it on. We've turned on about 35 homes. We came across part of the governor's order was for us to look at all the shut off homes in the whole, everywhere that we operate and maintain. And we found that there were about 200 that had been shut off, but about 90% of them were unoccupied homes. So all the ones that have been occupied that had been shut off have now been turned on again. As long as this emergency exists, we won't be shutting anybody off. We won't be charging late fees, those kind of things. We just want to make sure everybody has good water. We need to be all, we need to keep clean in this emergency. So we want to make sure that everybody has good sanitation, good fresh water.
Jim Nash, we've got to have our water right now. I just can't imagine trying to maintain my home without water right now. It would be, it's so hard as it is. It's already hard enough. And so I'm glad to see that you're doing that. I'm glad to see you were ahead of the state of Michigan on that. Thank you very much for that update. We appreciate it.
No, absolutely. We want to make sure our customers get the water they need and the sanitation they need. Without it, we're in real trouble.
And then the other big news, and we've got other things to talk about. You can't see it, but I'm holding my Clorox disinfectant wipes, and these things are doing a great job. They are keeping us healthy, but it's just not the kind of thing I'd really rather be talking about right now. But people are flushing these down the toilet. What happens? I mean, you're on the front line of that. What happens, Jim Nash, when we do that?
Well, put it this way: when toilet paper is actually an engineered product, it's engineered to break down basically as soon as it's water. When you flush your toilet and there's toilet paper in it, before it leaves your house, it's pretty much completely nothing left of it. Anything that you put in that doesn't do that is going to stick to the insides of pipes. If you put fats, oils, and grease in your sink in your kitchen, and it can line the inside of the pipes, even from your own property. And then these wipes can cling to the inside of that. And if over time it gets enough of it, it'll stop the flow and you'll end up with sewage in your basement. And with all the things going on now, you don't want sewage in your basement. So we're encouraging everybody to recognize that the only thing that should be flushed in your toilet is what comes out of you and toilet paper. Beyond that, anything that you flush in your toilet or put in your kitchen sink can end up blocking your lines. And it can not only block your own lines, but it can go downstream into these sewers, and you can get caught in filters for pumps. You can get caught in the pumps themselves. There was a few years ago, we had to replace a $500,000 pump because it had been so damaged by ragging that we had to replace it. So these kind of things can add up over time, and we make sure that people understand that the only thing that you should flush down your toilet is what comes out of you and toilet paper.
Yeah, I like saying, forgive me, I didn't have you on screen there for a minute, and I apologize to our audience. I always like saying, I'm a boater, so we're used to this in the boating world, I always like to say, if you haven't eaten it, then don't flush it down your toilet. If you've eaten it first, it's okay, right? Just keeps it kind of simple.
That's right.
Yeah, I just can't imagine. What kind of, is there any way you could describe, without being gross, what kind of mess you run into? I've heard these stories of these huge balls of debris that are stuck in our sewer systems.
What happens, and there was a case in London some years ago where they found what they call it a fatberg, which is fats, oils, and grease that combine with these things you flush down the toilet. And it was the size of 2 of those double-decker buses they have inside a sewer. So these kind of things can gather up over time and have significant impacts on sewers. We had a case about 5 years ago now in Farmington Hills where 14 bottom floor apartments all had sewage in their floors because a line in the road had been clogged with fats, oils, and grease from a restaurant up the road and backed up. So this can have a huge impact. The first time it happens to you, you'll never let it happen again. Trust me.
Anything we should be careful about? We all have garbage disposals in our house. We take almost a lot of people take almost anything and put it in the garbage disposal. The things we should be careful about?
Well, garbage disposals, if any kind of solid you put in this garbage disposal is ripped to such tiny pieces that it shouldn't have an impact.
Okay.
Even if you pour fats, oils, and grease into a garbage disposal, it will go through that garbage disposal and then solidify in your pipes. So even if you have a garbage disposal, fats, oils, and grease can be a serious problem. But if you do have one and you're putting food in it, it's going to grind it to the point where it shouldn't have an issue.
All right, well, that's good to know, Jim. You know, I can't believe I don't know this. I haven't had a chance to talk to a water expert on the show. We only got a minute or two more. Where's our water come from? The water that you provide to us, where's it come from?
The Great Lakes Water Authority supplies all the water for the big systems in Oakland County, including West Bloomfield, Farmington Hills, Commerce, all those areas. So they get their, the bulk of Oakland counties comes from Lake Huron. There's a intake 3 miles out in the lake, and then there's a water treatment plant right on the shore, and then it's shipped about 60 miles by pipe into our area. So it's very, very pure water out of Lake Huron, especially in this area. Some of the bottom corner of the county gets it from the Detroit River. Again, very clean water, and we have some of the cleanest water in the country in our Great Lakes Water Authority supply.
You know, that's good to hear, because you think of Detroit River, the water is coming from the Detroit River. It can't be that good, but you know what? I guess so. Okay, I believe it.
It's above the industrial areas. It's above the industrial areas. There have been in the past some issues with some Canadian pollution, but that was cleared up some years ago, and I haven't seen anything in more recent years.
All right, well, thanks for coming on the line with us today. Anything else you want to add during this crisis? We appreciate everybody that's keeping everything working, by the way, so thank you. You are definitely an essential worker, and your team and all the people that keep water coming. Anything else you want to add?
Oh, absolutely. My folks are out here, every day. Last year when it was 30 degrees below zero and the mailmen weren't delivering mail, my folks were out there working on water lines. So we are a dedicated group of folks. We have some of our teams off on a week for this emergency to make sure our folks are healthy. We want to make sure we serve the communities that depend on us, and make sure all our employees are protected. So we're working hard on that. We've been lucky so far. We haven't had any of our employees have issues with coronavirus yet. We had one person whose wife worked as a nurse in a hospital, and he's been off for a while now. But other than that, we have had no cases, and we've been quite lucky. So we're making sure that we're using our personal space, and we're not going to be infecting each other. And this is something we have to make sure that everybody that's serving the public is going to be doing.
Well, you talk about the ultimate utility that people totally take for granted, but the second there's a water main burst and we got to boil our water or we don't have it, then everyone's going, oh, man, this is important. That's so right. Thank you, Jim, so much. Jim Nash, Oakland County Water Resources Commission. Thank you for joining us and all you do and keeping the water flowing during this crisis. We appreciate it. We're going to take a break. We'll be back in just a moment. This is the Megacast. I'm Dave Scott. Back after this.
Hi, I'm Dr. Jonae Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Welcome back to the Megacast on 89.3 Lakes FM, 88.1 WBFH The Biff, and WAHS 89.5 Avondale Community Radio. And we also invite you to tune in on CivicCenterTV.com. Civic Center TV around West Bloomfield, Orchard Lake, Eagle Harbor, Sylvan Lake. And if you're in another community and you go to AT&T and you have AT&T cable, you can find us on Channel 99. I'm Dave Scott, Tyler Keefe here, and joining us now via Zoom, I see Aaron Lorenz, a mayor of the mayor of Sylvan Lake, and I think we're also going to be talking to John Martin. We don't see John, but I think we can hear him via Zoom. Mayor Lorenz, thank you for joining us on the Megacast.
Thank you for having us. I'm looking forward to talking to you, and thank you for the services that you do for our community.
Well, it's a pleasure. Thank you very much. So, Mayor and City Manager John Martin, we can't see you, but we hopefully can hear you. Thank you for being with us. So we're seeing that we're getting closer to a situation where things might start to get back to normal. We're beginning to flatten the curve just a little bit. We're not there yet, but we're beginning. President talking about states around the country that can begin to open up and others that aren't quite there yet. It's probably our case in Michigan, but we talked to the DNR. They're making plans. The state is making plans. The county's making plans. Mayor Lorenz, does that filter all the way down to our local communities as we get ready to open up?
Well, we will be following the recommendations of our federal government, and then ultimately the state of Michigan will make the decision about when we reopen our businesses and our economy. We have Governor Whitmer, who has stated that, we're going to go ahead and open these businesses using scientific evidence and follow what the experts say. So it's going to be interesting what happens here, because I'm sure, as many of the people are aware, we have, states that are in our group of states that are working together, like Wisconsin, that's extended their stay-at-home order up until May 20th or something of this nature. And, we have to see where the science takes us and how the curve flattens before we, move forward and open things up. And it's going to be interesting to see how the governor goes ahead and opens these businesses up. Right now we have things like only 4 people per 1,000 square feet of space in a retail facility. And, we don't know what she's going to do when she reopens up these businesses.
Well, I know everyone wants to get back to normal, but you're right. You got to do it carefully. Joining us also is the city manager of Sylvan Lake, John Martin. We can't see you, but I think we can hear you. John, are you there?
I am here.
All right.
Thanks for having me.
Hey, no problem. Thank you for being here. We hear you, and we see Mayor Lorenz. So, Mayor Lorenz, you could just move your mouth when John is talking. Then it'll all work out fine. Hey, John, do you want to add anything to that, to what Mayor Lorenz said about getting back to quote unquote the new normal?
Well, as he said, everybody's looking forward to it, and you said too. People are starting to get a little antsy, and we're all very anxious, but we also have to be just so careful that we don't have a flare up or something like that. I think that everybody's learned that the social distancing is so important, and I would expect that as things open up again, that will maintain, and people are going to be very, very careful for a long time, I think. We're all anxious. Yep.
No, go ahead. Forgive me. I didn't mean to interrupt. Continue your thought.
Well, I was just going to say it's everybody wants to get back to normal. And as far as what we're doing in Sylvan Lake, the mayor said it absolutely correctly. We're following the state and the county. We're in contact with the county regularly, getting updates and things like that.
Could be, and I'm just speculating right now, and it could be an interesting year for our Lakes area communities in Oakland County. In particular, we've already seen that the governor is going to be very cautious about exposing people in the southern part of the state to people in the northern part of the state because of the capacity of hospitals there. So it may be, as we come out of this, that folks looking for a boating and lake experience and some of the recreation that may not be available in northern Michigan, that they're going to stay a little bit closer to home. What do you think about that, Mayor Lorenz?
Well, I think it's going to be very, very interesting on how we proceed. Our business that I'm involved with, we work with, we have a number of international partners. Our headquarters is based out of Germany. We have partners in Hong Kong, in Shanghai, Malaysia. And I think when you look at what we're going to do, you have to look at the rest of the world. And I find it interesting. We hear the news about Germany opening up next week.
Sure.
And it sounds like, okay, Germany's just going to open up when you hear this news. But the reality of it is Germany isn't just opening up. They're opening up schools and they're opening up small businesses. When you look at pictures of Beijing, which I looked at earlier this morning that are posted on earlier today, the streets aren't that full. Everybody is wearing a mask. So, this tells you that it's not normal in China still today. You look at places like South Korea and Malaysia, they're not only social distancing, wearing masks, but they're actually tracking where everybody is on their cell phones and basically having interconnection of the apps on the phone so that if I was on a subway train with somebody that was tested positive, I'm going to be alerted on my phone that I was potentially, in proximity to somebody with the virus. And then it's my job to basically social distance so that I don't affect somebody else. And I think that's what we have to really realize here, that the most important thing is not only are we trying to protect ourselves, but we're trying to protect our neighbors. We're trying to protect our emergency workers. We're trying to protect essential employees. And so when we open up, we have to really be careful to make sure that we're not careless and potentially infect some friends and neighbors and other critical people that were around.
Aaron Lorenz, the mayor of Sylvan Lake, very well said. I couldn't agree more. We have to be smart. The government's gonna give us some guidelines, but it's up to each person to implement those appropriately and make sure we do the right thing. And in our individual case, it may be staying at home and not going out at all if we're sick, and or it may be interpreting these rules in a way that makes more sense for each and every one of us. I really appreciate and like what you say. In Sylvan Lake, you guys have been doing a really good job. By the way, Mayor Lorenz, you got a great backdrop there on Zoom. It looks really good. And John Martin, city manager, you've been conducting Zoom meetings, so we all adjust. How's that going? And are you having to make other adjustments in Sylvan Lake in addition to just the way we're holding meetings?
Well, we have downsized our workforce too with the stay home, stay safe order. So 4 of our 6 employees, City Hall employees, are at home. The DPW, as Jim was saying earlier, our DPW is off. They come in twice a week to empty trash and check our lift stations and things like that. Of course, they'll come in case there's an emergency water issue, sewer issue. But City Hall itself we're trying to maintain things as usual, but very short-staffed, which makes it difficult. And of course, not being able to come into City Hall and pick up things like dog tags and all our park stuff makes it interesting too. But we're working. Things are actually moving along quite well. We're adapting daily as new things come up. So we've had to make some good changes, but so far so good.
All right, well, best to you. I look forward to seeing both of you in person real soon and enjoying a probably 6-foot distanced get together, and we'll all get through this. Thank you both for joining us. Sorry we've run out of time. City Manager John Martin, good to hear from you. Aaron Lorenz, Mayor of Sylvan Lake, you're looking good, my friend. You look healthy, and I hope everything is well. Thank you for your thoughts today on the program.
Thank you very much for having us. You have a safe day.
You too. And there you go. I mean, he summed it up really, really well, Tyler. We all got to do our part. I mean, we got to do our part. We got to follow the docs. We got to follow the scientists. We're going to get there, but and he mentioned Germany, and they are opening up, and they're in better shape than almost the rest of Europe, but they're going to open up conditionally. There's no question about it. The same will happen here.
I would agree with that. I think that I would agree with that 100%, that we're going to have to do this gradually, and we're going to have to do this intelligently to the best of our ability to reopen our cities, reopen our towns, and reopen our country. And it's good to see that cities, big and small, are doing their part to be prepared for it and be ready for what they have to do, but also encourage their residents to continue to live the life that they live in their cities in a safe manner.
If you get an opportunity, head out to our website. It's lunchtime for many of you, and go check out the Carryout Club. A lot of great restaurants around our area that certainly would appreciate your business, and they are all listed there. Go to civiccentertv.com, the coronavirus page, and you'll find the top stories of the day as we are all working together to find the solutions to get through this very, very challenging time. Again, civiccentertv.com/coronavirus. And if you're just tuning in and you want to hear the whole rest of the 2-hour broadcast today, it will repeat on some of our stations. And for the rest of you, all you need to do is go to civiccentertv.com/megacast, and you'll find the entire show, archives of all the interviews, and a whole lot more helpful information. In fact, interesting interviews from the past month or so that we've been doing the broadcast. Tyler, thank you. Thanks to Larry Nyland doing a great job, our Zoom producer all week. Our entire crew, of course, Jeff, Captain Jeff, who's been the producer of the show, is booking all the guests and doing everything an incredible job. You, of course, and then about 20 other people behind the scenes making this show happen. We appreciate each and every one of you. Have a safe weekend. Stay home. Stay safe. Take care of yourself. And we will see you, of course, next week right here, Monday morning, 10 o'clock live, and the show will repeat over the weekend. Thank you for tuning in. This is the Megacast, and we thank you very much for joining us. Have a great and safe weekend.